We are going to discuss now jugular venous pulse or jugular venous pressure. This JVP, which is also called as JVP. Now, JVP, the most important question is where it is seen. Most of us think that it is seen externally, so it should be the external jugular vein. The answer is wrong. It is the internal jugular vein. Why we prefer the internal jugular vein is because its course is very straight, whereas external jugular vein, its course is kinky. It is not in a straight line. So the preferred vein to see this is the internal jugular vein. Internal jugular vein. And whenever any JVP recording is done, what happens is the waveform recorded will come something like this. And this has, as you can see here, there are three different peaks. There are three different peaks in this region. So what is the JVP representing? The JVP is representing the right atrial pressure because the right atrium is directly in connection with the vein, and whatever pressure changes are happening in the right atrium will be depicted in the jugular venous pressure. And the waveform, whenever it is recorded, we get a waveform something like this. And here we can see that the three peaks are named as A, C and V. These are the peaks, upward waves. Now coming to the downward waves or downward descents, we have two things. One is the X here and another one is Y. So we have to know what all the reasons for all these waves and what is the abnormalities in this JVP recordings. So coming to the upward waves first. So whenever the pressure in the right atrium increases, what is going to happen? There will be a rise in JVP because the right atrial pressure is directly being depicted in the jugular venous pressure. So what is this A wave? So whenever any atrial contraction is happening, suppose the atria is being contracted, what is going to happen? It is pushing the blood to the ventricle. That is one thing. But at the same time, there will be an upward deflection in the pressure of JVP because the pressure here will be directly transmitted to the JVP. So A wave is nothing but the atrial contraction. Remember A for A, it is atrial contraction. So during atrial contraction, it is also called as atrial systole. Atrial systole. Now what is the activity happening in the ventricle? The ventricle is receiving the blood. So ventricle is there in the diastole. It is in the ventricular diastole. But all the events will be represented with respect to the atria only because it is depicting the pressure of atria. So it is atrial contraction, A for A. Now coming to the C. Next, what happens after the atria is contracting? Now the atria has to relax. So ideally, the wave should have come something like this, whichever I am drawing in this figure. The wave should have come like this. But there is a slight bulge again. Why does it happen? Now the ventricular diastole is over and then the ventricle starts to contract. So whenever the ventricle starts to contract, what will happen? There will be a slight bulging of this tricuspid. This tricuspid slightly bulges into the atria. So there is a slight upward deflection of wave in the jugular venous pressure tracing. So this C, you remember it for cusp. This C is the cusp. And cusp bulging, that is due to the tricuspid bulging. What is the event in the ventricle? The ventricle is going under systole, ventricular systole. And the third wave, which is the V wave, it is nothing but the venous return. So what is happening now? The blood is emptied and atrium is relaxing. As and when the venous return is increasing, for the given volume of ventricle, more blood is coming now. So what will happen? There can be a slight rise in JVP. That's why we get the venous return wave. So we have done with our upward waves, that is the A, C, V waves. So upward waves are A, C and V. Now coming to the descent, already we have seen the atria is relaxing in case of the X descent. So X descent, what is happening? So the downward waves are the X descent. What is happening? There is an atrial relaxation. It is due to the atrial relaxation. And why is the Y wave happening? That is descent here. Here there was atrial filling or the venous return. This venous return, whenever the valve opens, suppose here let's take the AV valve is opening. Here the AV valve opens. Whenever the valve opens, what is going to happen? The blood is going to go into the ventricle. So what will happen to the pressure in the right atrium? The pressure is going to drop. And finally, there is the descent. So this Y descent is nothing but the atrial emptying. Atria is getting empty. So this is the atrial relaxation and it is the atrial emptying. So these are the classical waves. Now more than the classical waves, we should know what is their abnormalities. The abnormalities are, various abnormalities are seen. Let's discuss them one by one. What is the abnormality that can be seen in an A wave? A wave is due to the atrial contraction we saw. When can a large A wave can happen? So let's try out an example. So for example, this is the atria and ventricle. So whenever there is an stenosis here, what will happen? The atria has to pump through high pressure. So whenever it is trying to push the blood to high pressure, what is going to happen for the JVP? The JVP is going to increase. The A wave in the JVP is going to increase. So the large A wave is seen in tricuspid stenosis. It is seen in tricuspid stenosis. Then coming to the next one, it is written giant A wave. Large A wave stenosis. Giant A wave, or it is also called as cannon A wave. So whenever there is a complete obstruction, here we are not talking about stenosis, obstruction is there. The tricuspid valve is completely obstructed. What will happen? There will be a huge deflection there. So these two can happen in case of tricuspid obstruction. And why can and there is third one, that is the absent A wave. When the A wave will be absent, there is a condition called atrial fibrillation. In atrial fibrillation, what is happening is the atrium is not contracting at all. The atria is shaking. The atria is just like it is shaking like this. So what will happen? So the absent A wave is seen in atrial fibrillation, because whenever contraction happens, then only A wave can be present. Here contraction is not at all happening. It is just fibrillating. It is just vibrating. So in atrial fibrillation, we don't see a wave. Now coming to the next wave, that is CV fusion. The C wave and the V wave, it is getting fused. So when can it happen? For example, the V wave is due to the venous return and C wave is due to the cusp bulging. But they are getting fused. Whenever there is a tricuspid regurgitation, if the tricuspid valve is not patent and it is regurgitating from the when the ventricular contraction is happening. So what will happen? A ventricular contraction is happening, cusp is bulging and it is fusing with the venous return also. So there is CV fusion in case of a tricuspid regurgitation. Tricuspid regurgitation. It will fuse with a V wave. Then there are two examples for prominent X descent. When can the X descent be prominent? Whenever the ventricles are being obstructed, what will happen? The relaxation of the atria will be not proper. Suppose if the ventricle is surrounded by some kind of fluid or infection, what will happen? There will be prominent X descent. There are two conditions for this. The first condition is cardiac tamponade. Whenever there is a cardiac tamponade, there is a prominent X descent. Another condition is constrictive pericarditis. Constrictive pericarditis. In both these conditions, what happens is the atria is being obstructed, like the relaxation is not happening properly. So there is a prominent X descent. Then there is prominent Y descent. In which condition prominent Y descent can happen? It can happen in constrictive pericarditis. So basically what the question can be is, they will give you a scenario and they will give you some clues to identify whether it is a cardiac tamponade or whether it is a constrictive pericarditis. So our job is to differentiate it between these two diseases. How will you differentiate it? So let's see the diagram of them. So this is the diagram for normal as we seen. Then this is for the tamponade. Observe here carefully. What is it happening? There is no Y descent. Y descent is due to the emptying. Now in tamponade, what happens is the ventricle is completely obstructed. So what will happen? During this descent, the emptying from the atria is not proper because the tamponade is completely blocking the ventricles to receive the blood. So what will happen? The Y descent will not be seen at all. There is absence of Y descent. So that is one classical features. So we will write all the features. So if the question says there is an X descent, in both the cases X descent can be there. So we cannot differentiate it. And in both the cases they will give you JVP elevated. Both can be elevated in both of them. In both the cases there can be Kussmaul sign. So with these three features we cannot differentiate between the two diseases. What is Kussmaul sign? The paradoxical rise in JVP during inspiration. But normally what happens during inspiration? There is an increase in the thoracic pressure and the venous return is increasing. So the JVP usually falls in case of inspiration, but there is a paradoxical increase in JVP during inspiration in these two conditions, which is causing the Kussmaul sign. What is the three differences? I already told you these three things we cannot differentiate it. But one thing that is different from both of them is there is a prominent Y descent which is present in case of a constrictive pericarditis. and here the Y descent is absent, Y descent. Not only that, there can be another two clues also in the question, which can be in a cardiac tamponade. What happens is the tamponade is completely obstructing the ventricle. So ventricular filling is not happening properly. Ventricle will not contract properly. So what will happen? There will be absence of pulse. Absence of pulse. It is a very severe medical emergency. It has to be treated immediately. There is absence of pulse. And one more clue will be there is an immediate presentation. Whenever they say suddenly the patient developed breathlessness and his pulse is not felt, and when the JVP is seen, there is absent Y descent. So the more clue indicates more likely a cardiac tamponade. So the presentation is immediate. So these are the clues where you can identify whether it is a cardiac tamponade or a J or the constrictive pericarditis. Pericarditis is just an inflammation of the pericardium. It will also obstruct it, but not severely like a cardiac tamponade.